Nikki, devolution meant Wales was in charge of its own health service for the first time. So 20 years on, what sort of job have successive governments here made of running the NHS? Almost half of their entire budget now goes on health. And Wales has the largest and fastest growing proportion of older people anywhere in the UK. Some experts warn that the system might not be able to survive the next 20 years unless some substantial structural changes are made. Here's our health correspondent, Owain Clark.
Leisure centres aren't just for fitness fanatics. If you want proof, just take a look inside this hall. This is a game of walking football. It's a bit like five-a-side, but you're not allowed to run. Everybody here is over 50 years old. Some come for the company, others want to get fit.
I worked until I was in my 70s, and when I gave up work, I thought I got to do something to keep my body active.
I don't think medication will see you through the rest of your life without self-help.
Clubs like this are becoming ever more popular. In fact, Wales has the fastest growing elderly population of any UK country. 20 years ago, at the time of the devolution vote, just over 500,000 people in Wales were aged 65 or over. Last year, more than 635,000 people were of pensionable age, up by over a quarter. And in 20 years' time, the number's predicted to rise by almost half again. And more people living with long-term health conditions puts the NHS under even more strain. This surgery in Tre Thomas near Coalfields sees a high proportion of elderly patients. There are also significant levels of ill health in this former mining community.
It's not just about money, it's actually about bodies on the ground. It's about more professionals being able to provide a service for a population which needs more service because they're getting older, and older people get more chronic diseases and generally get sicker.
But how do you achieve that when Wales has a particular shortage of family doctors, and especially at a time of austerity, when public spending is now being severely squeezed, especially compared to the early years of devolution, when the money came flowing in?
An austerity period gets you to challenge really hard, gets you to look at the way you're spending your resources. For something in the region of 30% of people who go to seek medical care, that actually the solutions are not a pill or a hospital visit. Some of it's to do with loneliness, isolation and wider social factors. We've got to look for different solutions, and they're not always medical.
And it's company, not medical care, that made all the difference to Ada Ridsdale after her husband died a few years ago. Living in Newport, she benefited from a befriending scheme organised by the local health board, where volunteers come to visit and have a chat. And at 92 years old, Ada is now herself a volunteer, visiting others who are lonely.
You don't just sit here day after day, just watching television, not doing anything. When all your life you've been working till you were retired, and then to do nothing at all, you think, well, what can I do now? I've got to do something. So when this came along, I thought, good, I can get about, talk to people, and take the loneliness away.
Loneliness is a public health issue. There's increased risk of stroke, of heart attack in people who are lonely, increased risk of dementia in people who are lonely, falls. It's as harmful as smoking 15 cigarettes a day.
Back in Pontypridd, and those playing walking football are well aware, as they grow older, they too have a responsibility to look after themselves as much as they can. But the reality is many others will also need to be given the tools and opportunities to do the same, if the Welsh NHS is to continue for another 20 years to be there as a safety net for those who really need it.